Hello, everybody. Um, Welcome to Code Anatomy. We are going to solve a problem. My name is Nana. I am a creative geek or nerd. My background is in electrical engineering as well as computer engineering, and I love to solve problems. I happen to be a part of the team that created this wonderful platform, and today we're going to go through how to use it. So, last time I was attempting to record this video, I realized that it would be very helpful to distinguish between our requests that either give you an answer or taking an answer, right? So, any blue, what are they called? Like an action point or like a keyword. If you hit the word hints, and I learned that you can actually move around on the screen. So when you open this, you can actually just move it. So you can have this to the top right. I recommend having that there so you can see what's going on where, right? So these are your codes which help you perform certain functions, right? So let's read the problem. A 25-year-old woman is showing symptoms of persistent cough with thick mucus. Once you begin to see the symptoms, you want to start thinking, what system is this? Might this sickness be associated with? What might be happening? Let your mind start going like that. Now, the way we design this platform is to assist you in other learning. So this can but should not be your only source of studying. You should be studying your books, your textbooks, your materials, and this is where you would play your hands around what you've learned, right? So, for medical students, for bio majors, you should be learning your anatomy. Because if you see here, we each problem has an anatomical side and then a clinical side, right? The clinical side is where you're going to be figuring out the disease. So here, find the disease name, the treatment options, causes, and the organs as well. That's clinical. And the anatomy refers to like which parts are involved. So the organ, the system, the tissues, the cells affected, right? So we have persistent cough, thick mucus, shortness of breath, and recurrent lung infection. So I can already tell that this is in the respiratory system. So here's what we're gonna do. You're gonna start by running certain things. So you see here, system. I already have an idea that this is probably respiratory system. So I'm gonna say respiratory. Make sure your spelling is correct. I think it has space. It has spaces. Yeah, trying to remember. Get results. Okay, so it says I used a run, but nothing happened. That means that my code didn't run properly. So let's see. Let's try this again. Hmm, I'm thinking it's a respiratory system for sure. Uh, these guys up here just give you points. So they give you answers, and some of them take and give points. So let's see what happens when I hit disease cause. Here we go. So the disease is caused by a genetic mutation in the CFTR gene. All right, so now we have 25% complete in the clinical side. So I'm beginning to see, okay, I'm thinking it's respiratory system, and this is what it's caused by. What else can I see? What organ is involved? What's the organ function? Let's see. Here, the organ name. I have to find the organ name a little later. But these passages facilitate the exchange of gases. Which passages? And you see, answering this question has given me 16.67 on the anatomy side, right? So I told you the pathway for medical and anatomy is listed right here. Organs, systems, tissues, and cells is a pathway for anatomy. And then disease name, treatment, options, and causes. So let's see. Organ, cell. Again, because it's blue, you don't have to put in anything, but it might take points away. It also might give you points. So let's see. It gave us 1 point. Great. The organ cells involved are the epithelial cells, um, and the immune cells. See, we have the goblet cells, which are mucus producing cells. So all these clues are to help you find the disease in question. All right, beautiful. So now we see the cells that are involved. Let's see the organs that are involved. And see, we gain points on the anatomy side, 33%. So what organ tissues are involved? Beautiful. Here we lost 2 points. Uh-oh. But now you have an idea of what tissues are involved. All right. Beautiful. System options. If we click system options, I believe it will give you an idea of what kind of systems are involved. I do think that it's the respiratory system. I just didn't put it in right. So let's see. Medical side, treatment is always on the medical side. So can you suggest some treatments for me? Did I do that right? Treatment suggest, get results. Wait, did anything happen? All right. I mean, I did lose a run. I don't know if this thing worked. Let's see. Here, here, here. Oh, it worked. I did it twice. No. Well, we do have. Okay, actually, we gained 2 points by treatment suggest. Treatment use. Treatment use. Okay, beautiful. So now we use the treatment and we gain 25%. I love this. This is great. So the organ involved, based on my experience so far, I think the disease is cystic fibrosis. But I want to make sure that I'm putting it in right. Very good. I did get the name correct. Cystic fibrosis could be the name that aligns with the system symptoms. So 75%. Um, was that name or disease? The system I'm thinking is the respiratory. I don't know if I have to just enter just respiratory or I have to say respiratory system. Let's see. I tried putting in respiratory earlier and that didn't work. So let's see. Respiratory. Respiratory system. Bro, I can't afford to lose points. Let's see. Wait, nothing happened. Why? Alright, I'm at 75%. Let's see what else I can do to hit my goals. Let's see if I can put in something about tissue. I'm thinking the epithelial tissue and the connective tissue. So let me see if I can get some points that way. No, connective. Okay, so that gave me points on the anatomical side. All right. Let's see if I do epithelial, if I'd still get points. Make sure you get the spelling correct. You don't want to mix points because of the wrong spelling. Yay! Okay, good. Now we have 66% on the anatomic side. How do I finish the clinical? Disease name I did, treatment options, causes, and organs too. Causes. I already checked the causes. And I already used treatment. The organ, like, I mean, you want me to do organ? I'm thinking like lungs. Definitely lungs. What else? What other organs do you think would be involved? Because you guys saw that they said something about lung issues. Or maybe something along the lines of like bronchi. I don't know if it's bronchi or bronchi. Hey, yeah. Pronunciation is up to you. Bronchi. Let me try bronchi. And I want to make sure I can see my thing, so I'm going to make sure I can see it. Oh, good job, Nana. So here you can see it says, congratulations, you've completed 1 clinical case and have earned 5 biocurrencies. However, you can keep exploring more key codes considering you have 7 lifeline left. So at this point, I've successfully completed a clinical case. So I can save my results here and be done for clinical. I could also continue to pursue this and make this an anatomical video as well and just have it 2 in 1, right? What do you guys prefer? Do you want me to do 2 in 1, or do you want me to stop and send another video? Thank you all so much for watching.